The power supply was another big problem. Historic St. Mary's Hospital's electrical system was outdated. How were they going to provide a special 480-volt power source without conflicting with the existing system? The issue created a lot of anxiety within the hospital team.
When we applied for electrical power supply, there was no precedent to follow in Taitung, so we had to discuss this with the electric company many times. The result was to change the entire hospital's electricity network. To complete this power and circuit restructuring, preliminary estimates of the cost were around 5 million NT dollars. But with the help of the electric company and lots of local technicians, the problem with installing the new electrical system were solved.
After intensive meetings between the hospital's engineering group and the U.S. team, as well as the help of the electric company, the power supply was finally set up successfully. High-end medical equipment required a professional team to operate. Only then could this goodwill project be complete. But Taitung was a resource-poor area, and it was extremely difficult to recruit the right people.
To be able to operate this machine, the government stipulates that the hospital must have a CT scan machine and must be supervised by qualified radiologists with 2 years of trained MRI experience and 2 radiological technicians. For our hospital our size, there was simply no way to recruit people like this, and we also needed physicians specializing in memory diseases. It was so difficult.
Following the sudden regulation change, Taipei Medical University Hospital's Dr. Borong Huang's team also agreed to support Taitung with their expertise in breast cancer. Such a small hospital has taken up the responsibilities of serving Taitung, and they work hard to take care of their residents. This human sincerity has really touched me, and I knew that I had to come to help with this. The problems of transportation and manpower have subsided, leaving everyone in anticipation of this beautiful historic moment when the BMRI would be functional. On the one hand, Jennifer Chun can't believe that most of the problems have been solved, yet on the other hand, she secretly worries about future operations.
Maintenance fees alone for the service contract are nearly 6 million NT dollars a year, not to mention the cost for health promotion, health education, and training. However, we've already got such a big gift, and so we've put so much effort into this thing, we just have to say to ourselves, we must keep going. The last time when Jennifer first arrived in Taitung, she sent me an email saying, "Olivia, this is Jennifer. I'm in Taitung. Taitung has been devastated by Typhoon Morakot. I need help." It was a very short message. I was in the United States and immediately contacted my circle of friends. I told them of the seriousness of Typhoon Morakot in Taiwan and the need for resources in Taitung. These people in the United States have nothing to do with Taitung. They don't even know where Taitung is. But when people see how people's lives are devastated by nature, they are willing to lend a helping hand. So I thought, there is some good in the world. Many people are willing to do good things. So when I think of Jennifer worrying about the huge sum of the costs, trying to help people in Taitung to do the breast cancer screening, I believe there will still be many people willing to help and support the effort. The hospital will provide an annual quota of 1,000 free screenings to people at high risk of developing breast cancer. There are also some residents who require screening after diagnosis. They too will be given this opportunity. Of course, if you do not meet these conditions, you are not in these high-risk groups. So for those friends in Hualien and Taitung counties, we also want to provide a discount for MRI screenings and help them make MRI screenings a very easy and accessible examination.